I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. I have with me today Terry Broda. Welcome, Terry.
Oh, thanks, Dr. Escudé.
So, Terry, tell us about your work in this field, how you got started in this field, just a little bit of background.
Well, it's sort of a funny story. Most of the time we hear people will have either a family member or someone close to them that has a developmental disability, and that's kind of what spurs them into this field and gives them the energy and the drive. Whereas for me, I just kind of fell into it by accident. I was graduated my nursing program. I was working in psychiatry as well as neurology, neurosurgery, and a job came up in a psychiatric hospital because they were deinstitutionalizing individuals with IDD at the time. And they said, it's 2 days a week. Would you like to do that? And I said, well, I'm working at the neuro in Montreal and I can work at this other hospital and do that too. And I don't know anything about developmental disabilities, but I can learn. And so there you go. And that was about 30 years ago. So here you go. And I never left. So
we talk about this so often, and that's a story that we hear. And as you mentioned, it's either you have a connection to the field, usually from a family member, or you kind of just fall into it. And then once you're there,
you're just addicted.
Yes.
Yeah.
That's what happened with me as well, too. And also the part of not really knowing anything about it, which is one of the reasons we talk about health issues and health equity for people with IDD. And that's one of the things I'm going to pick your brain about while we're talking today.
Sure.
So you mentioned Montreal. So what do you do in Montreal?
Well, I'm actually a nurse in Montreal, consultant, and I'm a nurse practitioner in Ontario. There is not reciprocity across the provinces, so I have licensure that way. But in both of those provinces, I do the same kind of job. I work as a consultant for individuals with IDD who have challenging behaviors. And I've been doing that for 20 some odd years. I also do a little bit of teaching at McGill University, taught at this college level, worked up in remote northern communities with First Nations communities. And so had a bit of a varied background. I love the brain. So I've done a lot of my stuff has been like neurology, neurosurgery, psychiatry, a little bit in the elderly with dementia. And, that's kind of basically my background. But mainly now I'm semi-retired and I'm doing these two consulting jobs, which I've done for, 23 years with one and about almost 20 years with the other.
That's the excellent work and such needed work in this field. I bet you have lots of interesting stories over the years. Is there anything that stands out in terms of maybe a health issue that a person was experiencing that so something interesting that you can tell us?
Well, I laugh because inevitably, I don't think a day goes by that I don't talk about poop and constipation and the famous Bristol stool form.
I get that totally. In fact, I kind of have a nickname in some circles of being the constipation doctor.
I am the queen of poop.
Yeah. And that's
nice to meet you.
My pleasure. Wonderful to meet you. Yeah. And I always talk about constipation being the number one cause of just about everything. And I jokingly say that, but I always do this. And see, you get it.
I totally get it.
Why? Because sometimes you have to check annually, sorry everybody, but it's part of this world and part of this field. And it is amazing how many.
I mean, there's a psychiatrist that I work with in Ontario now, and I'm not working with her anymore because of lack of funding, but anytime that I was never there, I'd come back from vacation. She's like, Terry, I asked about poop. I did what you said, and you were right. There was a problem. So, yeah.
This is a funny story. It was actually really heartwarming. When I was back in Mississippi practicing, and I was starting to provide education and training to clinicians in the state there because we were moving people into community settings, and I had a lot of concerns that clinicians, might need some support to provide healthcare to people with IDD. And we had a person that was I was providing healthcare for, and one of our nurses took that person to a subspecialty appointment at the university, and the nurse practitioner that they saw asked how are his bowel movements, and she said because I had attended a talk from some doctor who mentioned how important it was to recognize, understand about bowel movements and the impact it has, and that nurse came back and told me, I'm like, yes, it's making a difference in reaching some people.
Absolutely.
So it was actually great to hear. So so constipation. You said you're really focused on the brain and the mind. So I bet you deal with a lot of seizures.
Yes, seizures too, and the variability. I mean, I worked at the neuro, and when I first started there, I had very little knowledge of partial complex seizures until I started working there. And the variability of presentation of seizures, I'm like, really? That's a seizure? It's mind-boggling and fascinating. And I think that's why I love the brain, because there's still so much we don't know about the brain and that we're still learning about. So, I mean, it's like I'm never stopping my learning. So I don't think that's good grammar, but you know it.
Well, you talked about the varying presentations, and one of the things that I talk about when I'm discussing health issues and people with disabilities is how are the interrelated behavior versus medical condition.
No, absolutely.
And in particular with seizures, when I talk about seizures, the presentations are so variable that we might not recognize it as a seizure. And so many times people will say, oh, he just, has this movement every once in a while, or he just does this thing because he has a disability, which is what we call diagnostic overshadowing, right? Right. And we need to think about things sometimes and say, could this movement that he has been doing for years actually be a seizure that we can treat?
Well, that brings me to a funny story. There was a gentleman we had, and he would take his shirt and kind of twist it around his neck. And they were like, oh, that's just Johnny. He does that all the time. He's been doing that for years. Well, he finally got to see an ENT at one point who decided to do a Panorex, who found this extra sinus in his skull that was full of pus, and they did some surgical intervention, treated him with antibiotics. And would you believe he stopped doing that choking behavior because they thought it was just some kind of self-stimulatory whatever, and it was not. It was actually due to an underlying medical problem. And Ruth Ryan introduced me to the DDNA, and she has been speaking about medical issues. Now she's Dr. Ruth Myers. And she's been speaking about medical comorbidities and how that's one of the main causes for a lot of the challenging behaviors. And I'm singing the same song, and I've been singing the same song for 30 years now too. And it's nice to be in the same choir together.
Absolutely. And that is one of the things I talk about when we talk about education of clinicians in general, which we know that I'm sure you would agree that there's a need to educate clinicians in this field about this, but we don't need to teach for instance, how to treat for aspiration pneumonia necessarily, or how to even treat seizures, or how to treat constipation, or whatever it might be, because those are things that clinicians do know how to do. But what we don't always make the connection in is understanding the different presentations that we see in this field. It's yes, this behavior for that particular person was indicating something that was medical and treatable, and that behavior went away once you identified the problem and fixed it. We see this a lot in dental issues as well too. People who refuse to eat, people who become agitated around meal times.
We had an individual who was aggressive at the table, threw his plate, and of course they were allowed to bring people back to the emergency if there was an aggressive episode in the group home. So we're trying to back up the story and find out, well, what happened? Well, he slammed the door and he hit the caregiver, and he never did that before, and threw his plate of food. And I'm like, okay, because he wanted a fourth glass of water and he'd already had 3. And I'm like, oh, does he get up at night and go pee? And they looked at me like I was psychic or had a spy camera in their house. And I said, can we do some blood work? Maybe he's diabetic. And sure enough, he was. So I don't know, people get a little hangry. And that's what was going on with him. And if we would not have kind of followed the storyline, backed it up a bit to find out the triggers and the extenuating circumstances around it, he might have been medicated with, an antipsychotic medication for his aggression instead of getting treated for diabetes.
Yep. Could not, or I certainly agree, and I've seen so many instances of that. And in my learning, I was part of some of these things. It's like, wow, I did not recognize this, and now I understand this. And that's one of the things that's why education is so important, because people need to understand this connection. Clinicians need to understand these connections. Supporters need to understand these connections as well to help reduce unnecessary suffering.
Absolutely.
Which can improve quality of life, which can reduce behaviors, which can reduce polypharmacy and the need for multiple medications.
Absolutely.
So many important things that impact the person's life, impacts healthcare, impacts the cost of healthcare, if we are able to provide appropriate healthcare to people.
The meeting on the little speed dating that we did the other night, they asked, what is it that keeps you in this field? What is it that you love? And I said, it's the little victories, because for the general population, it might be such a little tiny nothing, but for the quality of life of our individuals, it can mean so much. And it's those little things that keep you coming back and doing like a little dance of joy, because yes, we got that treated, and yes, now they're feeling better, or they're more awake, or they don't have akathisia anymore, and they're not so agitated and irritable. And it's so wonderful to see that. And that's what just keeps me coming back.
Just for clarification, everyone, we really weren't speed dating the other night.
No. Sorry, that's
we're coming to you again from the Developmental Disabilities Nurses Association annual conference. And so there was a little activity where people would move from table to table and talk about our experiences and who we are, just to get like to know people better. Yeah. So no dates were made from that. But anyway.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. I tell you, so wonderful stories, great talking with you. It sounds like you're doing fantastic work, and you've done fantastic work for many years in this field, and it's so needed. Pick 3 things that you would like people out there, listeners, to know about, to understand. Maybe it's 3 things that they can get involved in or do that can have a positive impact in this field, in the field of supports, services, health, wellness, people with intellectual and developmental disabilities. 3 things in 3 minutes.
Oof. Well, I think exposure. People need to learn a little bit more about individuals with developmental disabilities. They're not that much different than you or I, and I think there's still some stigma and an us and them attitude, which is really disappointing. And even Dr. Doody referred to, how, there's this lovely program for such and such, but this person has a developmental disability. No, he's not eligible. Mm-hmm. So I think that exclusivity, that exclusion that occurs is really disappointing. I've been doing this for 30 years, and it's sort of sad. I feel like I'm perseverating, because I'm saying a lot of the same stuff that you would think people might know already, and it would be transmitted and spread around, but apparently it's not spreading as far as it should spread. So I think if I had to hope or wish for anything is that the message would get out there more and that people would be a little more accepting and less of the little NIMBY attitude, it's not in my backyard kind of thing.
Sure.
So I think people who come into the field, if they can find out what are their local resources. When I started in this field, we had like 1 or 2 nursing textbooks that existed, and that was really difficult to try to actually get any hands-on information of references and resources and actual studies and data that were, really good, not necessarily double-blind, but, we've come a long way in those 30 years, and that's great. So I think trying to find those resources, whether they're local in your community or online, connecting with your local library to get access to some of those things. I know that it's maybe difficult, but I think we're moving more and more towards digital EMRs and things like that. And iPads in the houses and the communities, it's not all paper documentation. So they have access to those kinds of things and training, staff training, improving on that. I think those are some of the elements that really we need to champion and try and push forward as much as we can. I don't know if that's 3 things in 3 minutes, but
it's 2+. But yes, all great information and great action steps that people can take. Thank you so much for joining me today, Terry, and being a part of this, and for all of the work that you've done in this field over the years as well.
Thank you. It's been a pleasure, and I hope to give many more years.
Excellent. And maybe we'll have updates down the road. We'll do this again sometime.
Sounds great.
All right.
Thanks so much for having me.
Wonderful.